Hi there, it's Dr. Avi here, and I've got two guests with me today. We look like the three musketeers or the three stooges, depending on your frame of reference. I've got Larry Baker here from Oregon Health Sciences University. He's come all the way. He actually does some training in the US and the UK, and he's come to the PICRIS, the Primary Healthcare Research Conference in Sydney. I'm also with Michael Greco, who's from CFEP Surveys and Patient Opinion. And they've just run a training workshop that I helped co-facilitate on the patient activation measure. And so I'll turn to you. I mean, it seemed to me like it was a method of engaging general practitioners and showing them how to actually engage patients better through specific phrases and communication skills to improve that patient experience and engagement. Larry, do you want to talk a bit about what you're seeing around the world when you do this? Yeah.
I think as clinicians, doctors, and others who work with patients start to understand where the patient is in terms of their knowledge, skills, confidence to be partners with them in healthcare, they can tailor what they do in each consultation to make the visit a success for the patient, but also to reduce their own stress in working with patients as they move on this journey of becoming active partners in healthcare.
Yeah, and I really liked when you were doing the training, teaching the general practitioners in the room to ask specific questions, how to assess how confident they are at the moment, how to assess what level of knowledge they have and what level of skill they have. Could you give some examples of those kind of things?
It's amazing what you learn from the patient when you say, on a 0 to 10 scale, how important is it for you to lose weight so your blood sugars will go down? And it gives you an insight into what's important to the patient. If you follow up that question with, so it's a 2, why a 2 and not a 0?
Yes.
And you can learn out what's important to them in life for them about dealing with diabetes, not just what's important from your medical perspective.
And you can see how some simple questions like that, when you ask those questions and actually identify what's important to the patient, it makes the consultation so much easier and so much lighter. And you can see that reaction change on their side. You've had some example videos. You saw that reaction change. You're more likely to get that person actually complying with the health regime that they want and the health goals that they want.
Right. Yeah. Yep.
And Michael, you're doing some of this training in Australia. Where do you see the application in Australia with this patient activation measure and the training around that?
A lot of our work is within primary care at the moment, and what they're looking for are things like better health outcomes, as Larry's just talked about. They're also looking for reduced hospitalisation or hospital readmission, so reduced cost. And we touched on it just then about a better staff experience. That you mentioned the consultation being lighter and the clinicians being less stressed. And we're also looking at a better patient experience as well. So these are things that organisations like the primary health networks will want to, I would have thought, engage in. Particularly, one example would be the healthcare home. How in that first phase they're rolling these healthcare homes out, practices getting involved. Will the practices see that patients' health is improving? And will they see a better patient experience and that they have a better staff experience? It's what we refer to as the triple aim plus one or the quadruple aim. So I think we'll see a lot of this. And the beauty about all this, as Larry just mentioned, is that the evidence is quite strong that practice teams can tailor what they do, but they need to measure where the patients are in terms of their activation. In fact, we could call it a medical sign or a vital sign, just like blood pressure and whatnot, that we need to know where they are on that journey. There's no good saying to them, just go ahead and do this. If they're not ready to receive that information. So we need to sort of tailor that to where they're at.
Great. Excellent. Thanks, Michael. Thanks, Larry. Thanks for being here. And for you guys who are interested in engaging your patients better in communication, as well as helping your clinicians engage, do look up the patient activation measure from CFEP Surveys or from Larry as well. I'm Dr. Avi. Bye for now.